Welcome to another episode of MedTalk. My name is Dr. Tushar Patel. I'm your host for today's talk with cardiologist Dr. Kintur Sanghavi. So let me give you a brief introduction of Dr. Sanghavi. After practicing in a legendary academic teaching hospital for 11 years in New Jersey and acquiring experience of over 10,000 cardiovascular procedures, publishing multiple research articles and training over 100 cardiologists, Dr. Kintur Sanghavi, a board-certified cardiovascular physician practicing in Princeton, New Jersey, has opened New Jersey Heart and Vascular Care to provide a personalized, compassionate, and comprehensive care in all areas of the cardiology, interventional cardiology, and endovascular medicine. His motto is to provide cutting-edge, evidence-based, comprehensive cardiovascular care to each patient one at a time. So Dr. Sanghavi, before we start, I would like to give some stats about the heart disease. Heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in the US. One person dies every 36 seconds in the US from cardiovascular disease. About 655,000 Americans die from heart disease each year. That's 1 in every 4 deaths. Coronary heart disease is the most common type of heart disease, killing more than 300,000 people every year. About 18.2 million adults aged 20 and older have coronary artery disease, about 6.7%. About 2 in 10 deaths from coronary artery disease happen in adults less than 65 years old. In the USA, someone has a heart attack every 40 seconds. Every year, more than 800,000 Americans have a heart attack. Of these, 605,000 are a first heart attack, 200,000 happen to people who have already had a heart attack, and about 1 in 5 heart attacks is silent. The damage is done, but the person is not aware of it. So Dr. Sanghavi, based on the above stats, can you explain to our audience what is heart disease, coronary artery disease, and what is heart attack?
First of all, thank you very much, IndusTV, for the opportunity to come talk to your audience. And Dr. Patel, thank you very much for hosting this. So let's talk about heart disease. And to understand the heart disease, some simple facts, very simple 1-minute explanation of what the heart does for us. So heart works as a pump. Its job is to continuously circulate the blood through the entire body. So it brings it to the whole body where we can get oxygen, energy in all the vital organs of the body, including the brain, the eyes, the kidneys. And once the oxygen and energy is taken out, that blood needs to come back to the, get more oxygen and energy added. So the heart pump brings the blood back, sends it to the lung, gets it clean, again puts some energy that we ate food or nutrition, that whatever came to the liver circulation gets added onto the blood, and that again that blood circulates. So heart does this 60, 70 times a minute, 24/7 a day. That's why it's the most important vital organ, and something going wrong with it leads to death and disability. So what are the different kind of heart disease? So heart is an organ made up of 4 chambers. It has 4 valves. These 4 chambers have a wall. This wall is the most vital part of the heart because that is what pumps the blood. And this happens also because of electricity. Heart generates its own electricity for it to have an organized contraction and relaxation, or squeezing and creating vacuum to bring the blood back from the body. So this electrical activity is very important. This structure of the heart and its synchrony of working, when the heart contracts, the valve or the door of the chamber opens. It has to open enough. And when the valve relaxes, this door has to be closed. That's the only way it allows the blood sucked back into the heart. So that's the structure of the heart. So this is the second kind of heart disease, or the structural disease. But above all, the most common is the coronary artery disease, which is the heart muscle, the wall of this pump, the muscle of this pump gets blood supply or the oxygen and nutrient supply by nature's created artery. So this nature's created artery is called coronary artery, which travels on the surface of the heart, and that is what provides the energy and nutrition to the heart muscle. Somebody who does not know this might intuitively think that, the heart is working as a pump, the blood is going in through, why don't the heart gets oxygen and nutrients out from the blood that's flowing through its chamber? But it does not. The nature's design is that the heart muscle gets this oxygen and the blood supply through this nature's created artery called coronary arteries. So there are three kind of main heart disease. The most common one is the coronary artery, or the artery that supplies blood to the heart muscle, and the disease involving that is the most common cause of heart attack or heart disease and disability. The second common cause are the structural heart disease. So the valves of the heart, if they don't open appropriately, or if they don't close when they are supposed to stay closed, or if you have a hole in between the chambers of the heart. So those are the kind of structural heart disease. The third heart disease are the electrical heart disease, the electrical circuit of the heart, which requires heart muscle to, again, in synchrony, contract and relax. That electrical conduction, if it gets abnormal, there are different kind of irregular rhythm of the heart, which are called arrhythmia. That's the third kind of heart disease. Coming to the heart attack, the heart attack is caused by the circulation issue of this nature's design of heart artery, which are the artery that travels on the surface of the heart, and it provides nutrients. When that artery gets closed down, if you tie that artery down, for example, what happens is now the heart doesn't get oxygen and also the nutrients. It needs, for contraction and relaxation, to work as a pump. The muscle needs energy continuously. So if you cut down the energy source and the oxygen source, the heart muscle first stops relaxing, then stops contracting, then starts having some EKG changes, and then starts having some symptoms. So by the time when a patient starts feeling chest pain, chest pressure, heaviness, sometimes it's profuse sweating or diaphoresis, sometimes it's just nauseous. Patients are very nauseous. When you have this kind of symptoms, that is like already the effect of the heart. The heart is crying out of not having oxygen and energy. That is what is heart attack. So there are two kinds of heart attack. One is a major heart attack, which is seen on the cardiogram, and the second one is the minor heart attack. Again, these are lay language, lay terminology that are used all the time. The minor heart attack is the one that doesn't appear on the EKG or the cardiogram, and this heart attack generally is detected on the blood test. Sometimes it also appears on a cardiogram in a different way, and we manage these two different kind of heart attack a little bit differently. So we'll talk about the treatment aspect of it in a little bit, but this is just the overview of the heart disease in a three kind. And important thing that I want to bring up is along with the heart artery blockage, that when you have a heart attack and your heart muscle not getting oxygen supply or energy supply, the amount of time you allow this to go on, it decides how much heart muscle cell will die. And how much heart muscle cell dies determines the prognosis of how long a person will live and what kind of quality of life the person is going to live. So even if you survive the heart attack, but if a major wall of the heart is damaged permanently, then you are going to suffer something called congestive heart failure, which is the fourth group of the heart disease, which are the survivors of the heart attack or survivor of other heart condition, rare condition, where heart pump fails. Heart pump does not do its job of relaxing and contracting and circulating the blood efficiently through the body, and that's the congestive heart failure happens. So for the heart attack, time is the muscle. If somebody has heart attack and if they are treated immediately, and that's why when somebody has major heart attack, we rush them to the cath lab and go ahead and open the 100% blocked artery, and I'm sure we're going to talk more about that.
Yes, so that was wonderful explanation in a lay term for our audience, that what is heart disease and what is coronary artery disease. So are we as South Asians living in the USA are at higher risk than normal individuals in this country, and why the South Asians die from heart attack?
So you hit the point there. Southeast Asian origin population, it is at a very high risk of suffering heart disease, particularly atherosclerotic coronary artery disease. When I say atherosclerotic, atherosclerosis is the blockage formation process. So blockage formation in the heart artery is called atherosclerosis. So Southeast Asian population is at a very high risk for atherosclerotic heart disease. So just to give you perspective, the entire world population, we Southeast Asian population, that means India, Pakistan, Bangladesh, Sri Lanka, Nepal, this population comprises only 25% of world's population. But 60% of the heart attacks and the strokes happen in Southeast Asian population. So we are only 25% of the Earth's human population, but 60% of the heart attack happens in this 25% of population. So we are very high risk. Now, when it comes to Southeast Asian living in America, that's a really, a group of people which is affected by worst of both. The worst of the Western lifestyle and the genetics of Indian origin or Southeast Asian origin. So there is a study called Masala study, was funded by the National Heart and Lung Institute. So it is the mediators of atherosclerotic disease in the Southeast Asian population in America. That was the study. What they identified is that the Indian origin or the Southeast Asian origin population has fat around the visceral organ. So they are not obese, they are not big. They have a smaller body mass index in compared to what we see in the Western population. But they have this visceral fat around the organs like heart and the liver and the kidney. And this fat leads to a stress particularly to the organ, and it is the factor in creating the inflammation and atherosclerotic changes in the arteries. So Southeast Asian population, major problems are that they do not recognize early premature heart disease. They don't seek attention or treatment. They do not believe in preventive care. So unlike the Western population, they are unlikely to mitigate the risk factor before. And then their diet doesn't help. Also, there are some evidence that in compared to the body mass index, the Southeast Asian population has smaller heart arteries. So in compared to body mass index, in compared to other ethnic population, our arteries are smaller. And as an interventional cardiologist, we see this all the time, that the Southeast Asian origin population has multivessel blockage. So when we do the angiography, we see multiple blockage present. This is also again evidence-based that the Southeast Asian population in America is more likely to go for open heart surgery in compared to other ethnic population, because the prevalence of multiple blockage, long area of blockage in the smaller size arteries is very high. And that again is just explanation that the Southeast Asian population in America is at a very, very high risk in compared to all the other ethnic origin population here. The other factor about Southeast Asian population is presence of diabetes. So in America, 23% of, so in compared to let's say Latino and black population, the prevalence of diabetes is 16 and 17% in Latino and black population. In Southeast Asian population, the prevalence of diabetes is 23%. And this diabetes is different. In Latino and African American population, it's associated with obesity and insulin resistance. In Southeast Asian population, it's combination of both. So even though they are not obese, they are small body mass index, is that genetic predisposition or lack of receptor. And another thing about Southeast Asian population is that they have familial dyslipidemia, very common. So having very high triglyceride, high LDL, low HDL, those kind of condition. I'm sure we will dive into that a little bit in detail.
Yes.
But these are the reason why Southeast Asian population is at very high risk. Lastly, the Southeast Asian population eating habit in America is muddled with the Western food along with their goodies from India or Southeast Asia. So that plays a big role in having higher risk of heart artery disease.
So wonderfully explained. So how about some risk factors which people can control, which in our hand, and some we don't have control over And what are some of the lifestyle modifications people can do to avoid heart disease, hypertension, diabetes, or hyperlipidemia?
So let's talk about the risk factor for the atherosclerotic heart disease or heart artery blockage or the blockage formation process. The most important predictor of blockage formation is the age. At age 25, if you do angiography of the heart arteries of 100 people, hardly 10% of the people would have some form of atherosclerosis. If you do that in Southeast Asian population, probably there will be about 20 to 25% population with some form of atherosclerosis or blockage formation. If you do the angiography of 75 years age group people, 75 out of 100 will have some sort of blockage. So the aging is the most important predictor. As we grow in our age, we increase our risk of having a blockage. Now that is beyond our control. We cannot do much about it. You can age as gracefully as you want to, but you can still form the heart artery blockage. The second common, again, male are at a little bit more higher risk of developing heart artery blockage at an earlier age in compared to females. The menstruation protects female. So until postmenopausal age, the male and female have a little bit risk difference. The men are a little bit higher likely to have heart artery blockage related problem in compared to women. But once that is gone, and this is one of the major problems we're facing, that women's heart disease, women's health is quite under-recognized and under-managed. And women busy taking care of their family, don't seek attention, but that's where we have been wrong. And that risk factor, again, I want to emphasize that nobody gets a wrong message out of that women are protected and they are okay to not worry about heart disease, because women are at the equal rate of heart disease once postmenopausal age approaches. Not only that, the women have presentation of disease quite differently, and so it is gone under-recognized or untreated for a lot of women. So that's something to keep in mind. The traditional risk factors for the heart artery blockage or atherosclerotic heart disease are high blood pressure, high cholesterol, or we should say dyslipidemia, diabetes, okay, smoking, tobacco, any kind of tobacco abuse or tobacco use is a risk factor. Very important risk factor is the genetics or family history. If your parents suffered a heart attack at age 55 or below, or even age 65 or below, your chances of suffering a premature heart attack are very high in compared to somebody who does not have their parents had same problem. So genetic factor or the family history plays a major role. So now coming back to high blood pressure. High blood pressure is now in America 1 in 2 adults. So between two of us, one should have a high blood pressure. 1 in 2 adults in America has high blood pressure. High blood pressure, what it does is basically, if I can simply explain, the heart is continuously working against more pressure, right? So in a simple, again, I'm trying to simplify that, it's not as simple, but what it does is the heart muscle over the years of working against high pressure, the muscle becomes thicker and stiffer. So heart has to work as a pump, it has to relax normal also. A thick and stiff muscle cannot relax enough, cannot bring the blood enough back. It then generates pressure onto the upper chamber of the heart, which then leads to irregular rhythm of the heart. Then at some point, this thickening, the muscle that is working hard gives up and causes heart failure. And this also leads to the hardening of the artery. So when the blood pressure is high, the atherosclerotic process or the blockage formation process goes on, and something called arteriosclerosis happens, and that also is a reason for having heart attack. The better the blood pressure is controlled, the lesser likelihood of having this remodeling or the changes on the heart and the vasculature, and you are less likely to have a problem at an earlier age, and you can push the problems out to the later age. And that's why it's very important to recognize, because high blood pressure does not cause any symptoms. Majority of the people with high blood pressure don't even know they have high blood pressure. So they are not treating that. And when you are not treating and you're walking around with your high blood pressure, your heart and vasculature is getting affected by that. So control of high blood pressure is important to control the risk of blockage formation. When it comes to diabetes, diabetes was considered, according to Ayurveda, 5,000 years ago, this was the king of disease, the Raj Rog, the king of disease. And they knew it then, and we know it now, that the diabetes plays a big role in the formation of blockage, and it leads to heart attack and stroke. And it's the most dramatic effect of any risk factor. Hypertension is considered the most common or the world's leading cause of death and disability because it is affecting a large amount of population in compared to diabetes. 1 in 2 adults versus 1 in 6 with diabetes. But whoever has diabetes is likely to get heart attack, stroke, kidney failure requiring dialysis, retina changes or changes of the eyes and not being able to see. Those things are likely to happen to diabetes and compared to any other disease. So diabetes, again, the control, when it is better, there is less sugar circulating in the blood, the less blockage formation happens. And I'm sure we don't want to dial into the diabetes in particular, but very important that there are 2 types of diabetes, type 1 diabetes, type 2 diabetes. Type 1 diabetes is where you have lack of insulin, you are not generating enough hormone insulin to digest the sugar that you ate and that's circulating in the blood to be used for body's activity or energy, like when you are breathing, when you are taking shower, when you are digesting food, all this activity requires energy. And this energy comes out from what we eat, and this whatever we eat, the sugar goes into the circulation, and the hormone insulin connects with the receptor of different cell and helps absorb this sugar into the bodily energy. So when either you have lack of insulin, you get diabetes, that's type 1 diabetes, or the receptors that help utilizing the glucose and come into the blood, into the cells of the organ, that is type 2 diabetes, where it's much more common. And either irrespective, what is important is you have to have a very good diabetes control to reduce your chances of suffering blockage. Again, same thing, the better the sugar control, later in your life, much later in your life, you are likely to get complications of diabetes. So it's very important. And third and the final, very common and most common kind of risk factor for the heart artery blockage is the hyperlipidemia, dyslipidemia, or high cholesterol. Different terminology because there are different way it manifests. But essentially, the cholesterol is essential for our body. Fatty acids that we eat are very important for the brain's function and all the vital organs function, in fact. This comes from the food that we eat, and this cholesterol, there are different kinds of cholesterol. If the bad cholesterol in the blood is high, then that leads to blockage formation process. There are rare but different kind of lipoprotein, or the protein that are vehicle to use the cholesterol from the blood and transfer it to the cell. That irregularity also causes the blockage formation. So cholesterol control, again, there are tons of evidence that if somebody has a LDL, which is the low density lipoprotein cholesterol, if that is less than 100 versus it is more than 170, the risk of having a heart attack are very different. So again, that's something we know very clearly, that cholesterol is a major risk factor, and by lowering the cholesterol, the bad cholesterol, you can reduce your risk of having heart artery blockage.
So now we know the causes of heart disease. How do we diagnose heart disease? If a patient comes to your office with all these symptoms of diabetes and hypertension and some kind of uneasiness, chest pain, what kind of tests do you do?
So patients with the heart disease can be symptomatic or asymptomatic. In your opening statement, you said that 1 in 5 heart attacks are silent. The damage is done before they know it, right? So for preventive aspect, we investigate the patient if they don't have symptoms a little bit differently. If the patients have symptoms that are concerning for heart disease, say for example, somebody has chest discomfort, pressure, heaviness. In Southeast Asian population, commonly described terminologies are ghabrahat, ghabraman, or uneasiness in the chest. Also, Southeast Asian population commonly have presentation of burping. They feel that it's the indigestion, it's a gas, but it's not that, it's heart. Palpitation, feeling like your heart is racing or your heart is skipping beat. Shortness of breath. when before you could climb 2 flights of stairs easily, now you get to the second flight of stairs and you feel a little winded, you're having a little bit shortness of breath. If that's happening, that are symptoms. When somebody has symptoms, then we investigate them a little bit differently. So if somebody does not have any symptoms, our goal is to make sure we detect high blood pressure, diabetes, cholesterol levels or high cholesterol ahead of the, before it starts causing damage to the heart and the body. If there are patients with high family history risk, but their cholesterol and diabetes, everything is fine, at times we use something called calcium scoring in the heart. So you can do a CT scan of the heart and find what is the amount of calcium, and based on that, we become aggressive in how much medication and things we can use to control the risk factor. Now, if a patient has symptoms, depending on symptoms and presentation, we investigate them differently. If a patient came to my office and says, when I climb a flight of stairs, I have these symptoms, I may do a stress test. I do first the cardiogram. The electrocardiogram gives us a lot of information. It's like, for us, it's like fifth vital sign. And once that is done, we can do exercise, EKG or stress test to reproduce the symptoms. That tells us that when the heart is in need of more oxygen and energy, is there enough blood supply? Is the patient having any symptom? Is the blood pressure responding to exercise? Is the cardiogram changes with the exercise? So we can do that kind of test. We also do something called echocardiogram if we find that this patient is likely has suffered a silent heart attack. So by doing a sonography of the heart, we know if there is any damage done to the heart muscle or not. So these are the different testing we use to investigate. If a patient came in with similar symptoms into the hospital in an emergency situation, and we saw something on the EKG, then all these tests are not needed, and what we may need to do straight is doing catheterization. So we can go through the wrist artery to the heart, inject dye, take pictures of the heart arteries and see if patient has a blood clot in the heart artery or if they have a blockage in the heart artery, and then depending on what it is there, we can treat them differently.
So we covered the causes of heart disease and the diagnosis. Let's talk about medical management and the newer technology or advancement in technology, renal deprivation. Can you explain what is that?
So you brought up a very interesting topic, particularly for me. So evolution in the treatment, in the cardiovascular disease is just amazing. This field has led the growth of evidence-based medicine in last 30 years. There has been very organized investigation of treatment options for the all cardiovascular disease and things around it, and that's why we have some amazing development in the treatment. Before 30 years ago, if somebody had a heart attack, we were giving this clot buster medication that caused a lot of immune reactions, streptokinase. Yes. From there to now, the healthcare system has evolved to the place that if you have symptoms of heart attack and you come into the heart attack, there are this drug-coated stent that we put in matter of minutes, going through your wrist artery, open the blocked artery, and the patient goes home the next day or day after. So amazing evolution in the treatment. Evolution in treatment of every aspect. Cholesterol management has improved immensely. There are newer molecules. We can now see patients' cholesterol level come down to the expected or target range much easier. Similarly, diabetes, there are about 5 different class of new medications that came in the market in the last 15 years in diabetes, and that has really changed how we manage the diabetes. We have sensors that can sense the blood sugar without doing a pinprick. We have insulin that gets injected based on what is sensed. So it's just amazing what has happened. One area where evolution of the treatment has not happened is the high blood pressure. For high blood pressure, in last 20 years, there is essentially no new class of medication. We are using same medications that we had, and blood pressure control is still a problem. In 2021, 1 out of 3 patients who is suffering from blood pressure, their blood pressure is not controlled. So that's where we investigated something called renal denervation. So based on basic science research and the animal science, as well as based on human science of years of understanding, that high blood pressure happens because of overactive sympathetic nervous system. Sympathetic nervous system is the autonomic nervous system of the body. That's body's fight and flight response. So whenever patients have high blood pressure, what we have noticed over the years is that their sympathetic system is overactive. So we can do a procedure, in a minimally invasive procedure, by going through either wrist or the groin artery. You can go to the kidney artery, and there are nerves that travel on the surface of the renal artery. These nerves are the ones that are overactive and causing high blood pressure. So we can disable or zap those nerves or tone down those nerves, and that's how we can tone down the overall sympathetic drive, and that translates into reduced blood pressure. So this is something that I have been very involved in last 10 years plus, about 11 years of doing this research. And just recently we presented the data at American College of Cardiology annual scientific meeting as a late breaking trial, and it is published in Lancet. So what we find is, using ultrasound as an energy, you can tone down this overactive nerve, which then in turn translates into reducing blood pressure by about 8 millimeter of mercury of mean reduction. It can range as high as 30 millimeter reduction, low as 4 millimeter reduction. So again, this is an investigational treatment, but this is exciting field for the high blood pressure research, because that's what's lagging behind in modifying the risk factor for the heart vascular disease.
So if the patient is eligible for this treatment, can he come to see you in your office, or how does that work?
So anybody who is interested in the alternate treatment of high blood pressure, there are 2 trials that I'm conducting. One is for patients who are having moderate or mild high blood pressure. So somebody who requires 2 medication, 1 medication, but is tired of taking medication, wants to explore alternate option of the treatment. They can check this out on my website or highbptrial.com. The patients who are suffering from more severe hypertension, it's a different trial where patients are taking 3 or more medication, considered severe resistant hypertension. There we use chemical energy to do renal nerve ablation. Again, can contact my office and we can steer them through a FDA approved clinical trial where they need to go through a few steps in order to participate.
So we discussed etiology, diagnosis, management. Now, can you explain, and I as a primary care physician, I used to get this question all the time, can we prevent heart disease? What are some of the tips you can give to our patients or our audience preventing cardiovascular disease or heart attack or any heart condition?
We'll start with the prevention and then we'll come to the treatment. So prevention is always better than cure. This is something we have learned growing up, and unfortunately in the Western lifestyle that we live in, on a day-to-day basis, everybody's lifestyle where you are continuously on the go because you need to do this, that, and do everything else, the preventive aspect is forgotten very commonly. It's not as difficult. It's just having simple involvement of lifestyle modification, and once it becomes a habit and it becomes routine. So what are the things you can do? I think eating healthy, it's very important. Eating healthy not only in terms of, everybody knows, cheesy, greasy food, high cal food, red meat, densely packed calorie, like your 1 scoop of ice cream has 800 calorie, or your 1 Big Mac has a 1400 calorie. Of course, everybody knows those are the bad things for you. All the processed food with high calorie are bad. Fresh, low calorie, high fiber content, so vegetables, fruits, grains, lentils, they are much better for you. Fish is better than any other meat. White meat is better than red meat. These are just general, dietary lifestyle you can do. But I think more importantly, fresh food has a big impact on health. We eat from what we eat from supermarket. We think it's fresh. It's a year-old fruit that's sitting there. These are all gone through a lot of processing. So I definitely think the retro in this particular, the fresh food not infiltrated with chemical plays a role in reducing the inflammation. I think for Southeast Asian population, particularly living in India, as I was part of one investigation or study, what we identified that the inflammation markers are so high in these young Indians who are having premature heart attack in their 30s and 20s even. And some of that is blame to the exposure of the chemicals in their food and in their diet. So I think that's important when it comes to the diet. Second thing is exercising. Aerobic activity plays a big role in preventing heart attack. Somebody who is doing 5 out of 7 days aerobic exercise is about 50% less likely to suffer a heart attack in compared to somebody who is not doing that exercise. And similarly, if you suffer a heart attack and if you are doing aerobic activity on a regular basis, you are 50% more likely to survive in compared to somebody who was not doing aerobic exercise. So jogging, biking, swimming, running, walking, brisk walking. If you don't have time to walk 1 hour, do 20 minutes of Stairmaster. They do the same effect on the heart. So those are the simple tips of exercising.
Yeah. So last question regarding South Asians. I'm involved in South Asian population for last 3 decades with their care through various health fairs and many other activities. What is the message for them? Prevention is always good, but when they have chest pain symptoms, they don't feel well, uneasiness, what is your advice for those individuals? Because I have seen and personally lost many friends in last few years that they waited at the last minute and drove actually to the emergency room to get the care when they had the acute heart attack or acute myocardial infarction. What is the message for those individuals?
I think you are hitting it right in the center of the problem for Southeast Asian population. The common thing that I have seen is that people think the symptoms is from something else. Denial is a common factor. Once they recognize that this could be heart, they do not attack it as quickly or with the system in place, they don't do it. So let's take a step back. Symptoms: chest pain, chest pressure, heaviness. Generally heart gives pressure and pain in the center of the chest. It's not left side, it's the center of the chest. It travels to the shoulder, it travels to the jaw. It feels like it's going down the arm. You may get numbness in the hand. You may get a lot of sweating, profuse sweating. When you have that, consider this could be heart. You may or may not have, but shortness of breath is another symptom. You may feel lightheaded or may feel like you're going to pass out. You may not have all of the symptoms. You may not have any of the symptoms and only have one symptom. In Southeast Asian population, I have seen commonly that after eating meal, when they eat dinner, after they feel like I have gas and they are burping, and then sometimes they say, when I burp, I feel better. These are common symptoms of heart attack. I have seen many patients staying home with the symptoms and thinking that it's something else, and then later on either finding out they have heart attack or later on I'm going to their funeral. So very important to recognize the symptoms. Number 2, if you have these symptoms and if the intensity of the symptoms is high, then in America we have an excellent healthcare system in place where you do not want to try to drive yourself or have your spouse drive you to the emergency room. Call 911, let them come, and they are equipped to do whatever they need to do on site. Going a little bit into the treatment, if you are having a heart attack, when the EMS guys come in, they will give you baby aspirin. If you have baby aspirin at home, at least chew the baby aspirin, 2 of them, if you are having the symptoms. When they come in, they will do your EKG and they can alert the healthcare system that this patient is having a major heart attack. So by the time you come to the hospital, I might be at the hospital waiting for you to go into your heart artery through the wrist artery, and by using wires and balloons and stents, which are like little metal spring, we can go ahead and open up the 100% blocked artery. Time is the muscle. As quickly you reach to the hospital, as quickly the artery gets opened up, less likely or less amount of size of muscle damage happens. Lesser the muscle damage happens, lesser chances that you will suffer consequences or complications of heart attack. So you would less likely to suffer heart failure, irregular rhythm, less likely to require defibrillator and things like that, more likely to live longer. So very important, you recognize symptoms, you get the treatment attention promptly. If somebody has multiple blockage and requires more treatment, there are other treatment options such as open heart surgery, but very important to recognize these symptoms and act on it promptly.
Excellent information. So any role of alternative treatment in preventing heart disease? And this question, I get it all the time, that hey, drinking wine or red wine or white wine or eating grapes. Anything is beneficial.
So, before I talk about this alternate treatment or alternate aspects of preventing cardiovascular health, I want to make sure people understand. If you have a blocked heart artery, if you're having angina, if you are having a heart attack, no alternate treatment will help you. You cannot cure blocked heart arteries by yoga and meditation. I know people talk about it. It is not possible to cure it if you are having symptoms already. Now, if you have not developed symptoms, you can prevent progression by alternate treatment. So, lifestyle, alternate treatment plays a big role in preventing the progression of atherosclerotic vascular process or atherosclerotic heart disease. And in that, I would say number one, other than diet, exercise, I would say is meditation plays a big role. Our lifestyle is associated with a lot of stress. Stress leads to inflammation and disruption of the plaque, and then leads to heart attack. So yoga, meditation, when I'm saying yoga, not necessarily just the bodily exercise, but the meditation part aspect of it can really reduce your sympathetic tone, can control blood pressure, as well as reduce your risk of heart attack. When it comes to wine, there are definitely not one, multiple evidence that a glass of wine on a daily basis may reduce the heart attack. Again, these data are all over the place because these are difficult studies to do and have very powerful evidence. So when I'm saying that there are studies that showed it, does not mean these studies are extremely powerful and you can live by that and start drinking wine every day because that's going to prevent your heart attack. That's not true. Chocolates have some positive effect. Coffee in excess can cause arrhythmia, but a small amount of coffee also has been seen as a preventive factor in heart attack or atherosclerotic heart disease. Again, these are studies which are mudded with a lot of other covariables, and these are not definitive like we can talk about medical science.
Thank you so much, Dr. Sanghavi, for coming to IndusTV. Wonderful discussion about heart disease, causes, diagnosis, treatment, management, alternative way of preventing. Thank you so much for your time and wish you all the best in your practice here in New Jersey.
Dr. Patel, thank you very much. IndusTV, thank you very much for the opportunity to talk to your audience. It's a pleasure.
Thank you.
Thank you.